today is on restarting population level surveys and household level data collection in humanitarian situations during the COVID-19 pandemic. This presentation will be done by Dr. Oleg. So welcome, Dr. Oleg.
Thank you, Hassan. Next slide. We have 15 minutes on this call to talk about this document. So just to preempt frustration, we will not have time, unfortunately, to go into all technical details. If you're familiar with this document and read it already, and you have some technical questions, obviously, we will have 10 minutes for question and answers. If not, I suggest that the organizers will include the link, first of all, link to the document on the website where everyone can access and download and read. And this should be probably in the final version of the slides that we put from this webinar. And second, we will probably provide an email where you can email your questions later as you read the document or as you try to implement survey and you have some questions so that you can contact the Smart Global team and they can answer your question. The goal of this document is really to first help you think whether you should do a survey, a door-to-door, face-to-face household survey in this context of COVID in various settings. And second, if you decide that you will do it, to give you guidance on what necessary precautions, what we call IPC, infection prevention and control precautions you need to take to safely conduct data collection and training. And finally, we give some guidance how you can calculate the amount of additional personal protective equipment, PPE. So you see that I'm starting to use some lingo. IPC is infection prevention and control, and PPE is personal protective equipment. You will find that this document, we tried to make it as short, as clear, concise, and to the point as possible. So it's not 55 pages, it's not even 25 pages. It's 9 short pages, and it should be quick and easy to read, and hopefully quick and easy to understand and to implement. So just to repeat, the main objectives are help you think and decide whether you should do survey in your situation during COVID. And second, if you decide to do, to give you specific recommendation, what you need to do additionally to ensure safe data collection. So this is just, this slide is an outline of the main section in the guidance. We will have introduction, objective, and then this principal consideration is to help you think whether you should resume the survey. And then the next 2 sections, technical, operational, and training recommendations are how to keep safe responders and team members. And the last one is like a table to help you guide how to calculate the need for additional PPE, for additional protective equipment, and also disinfectants during your survey. Next slide. Next slide. Thank you. Sorry, 1 slide back. Yes. This slide is about helping you think whether you should be resuming survey or not. Obviously, we know that any smart survey during COVID or not has to be thoroughly justified. We need to justify whether we actually need to collect this data now, or previously collected data is still relevant, or maybe a situation did not change so much, or kind of, we don't see any need to collect data now because there are other priorities. So it puts an extra burden on your proof to kind of, first to start thinking about survey. Obviously, you have to have very, very good justification, and if it's a low prevalence setting, and if we don't see any specific signs that the situation may be objectively deteriorating, it's not like you think that it may be deteriorating. There have to be some specific evidence from the field that it is deteriorating significantly, that we need to measure it now. And then obviously you have to approve, you have to agree that you will be doing data collection face-to-face with the country public health authorities. So any data collection, we cannot put any algorithms or whatever. We can just give you some ideas what to think about, but ultimately this conversation have to finish with the national public health authorities, with the National Ministry of Health or whatever, that will say, okay, we approve you conducting the survey. Obviously, in your thinking, epidemiological situation has to be a primary consideration. And we know all these epidemiological indicators, right? Number of new cases, incidence of new cases per unit population, number of tests performed per day, percent of test positivity, et cetera, et cetera. Unfortunately, in the countries where we work in, these COVID statistics are not always the best quality and not always reliable, because if there is no testing, or if testing is not widely available, especially in these rural areas where you may be planning your survey, then basically COVID statistics doesn't mean much, because there may be no cases, not because there is no cases, but because there is no tests to detect these cases. So that's why we are not giving any specific numbers, any specific thresholds, what should be epidemiological situation that will permit you to conduct a survey or will prohibit you to conduct a survey. But we emphasize that the situation should be evaluated and discussed with the public health authorities, maybe even with the WHO country office that could weigh in on the seriousness of the situation. And obviously countries where there is a widespread community transmission, for those countries, we should exercise the biggest caution, and there should be very, very strong justification to conduct a survey in those situations. Otherwise, we can say that survey should be postponed until better times. Obviously, you cannot conduct survey without PPE, without personal protective equipment. You cannot conduct survey without qualified staff, and you cannot conduct survey if there is a country-wide restriction of people moving from place to place. So unless you can get personal protective equipment secured, unless you have a qualified staff that is willing to put themselves at risk and go and collect data, and unless you can secure permissions to move your stuff around, probably it will not logistically be possible for you to conduct survey, even if epidemiological situation permits and you can justify it. Next slide. So this is one of the two slides on our recommendation, what procedures you need to put in place when collecting data. So this slide talks about field procedures, and there are a lot of these little things that you will need to do in the field that will be maybe unusual for your teams because you've never done this before. The general consideration to keep your interview time to the minimum, to keep the questionnaire as short as possible, to calculate your sample size as minimal as possible, and to make sure that when you recruit enumerators, they are not old and they are not having non-communicable diseases that can put them at risk for severe disease if they contract COVID. You also need to make sure that you're following all the common procedures. You are not cutting any corners, but you are using the same procedures as always to measure anthropometry. Because if you are not, then you will get lower quality data, and all your efforts and all your risk for people collecting data in this situation will probably be in vain. So our recommendation is to not modify the procedures, not to let mothers measure their children, and to follow as rigorous standard methods for measurement as usual. And then, as I said, there is a number of things that you need to do in the field to ensure infection prevention and control. Obviously, to keep a distance between interviewer and respondent, to conduct interview outdoors, to make sure that other people are not congregating around, to make sure interviewers and measurers are wearing masks, to encourage the respondent and the measured child to wear masks as well, especially if the child is older than 2 years of age, to screen households to ask if there were cases of COVID, if they were in contact with known cases, and screen them at least for fever, for the temperature. So, and also to disinfect the equipment and to change gloves. So all these details you will find in the document. And again, if you have questions, you can ask later. You can email your questions to the Smart Global team. Next slide. So all these are the procedures that I just mentioned, and you will find more detailed description of them in the document. Next slide. Now, a separate section is the team procedures. How you should manage the teams when they are not doing field work. So basically, like during evenings, in the nighttime, in the car. First of all, the recommendation is to not intermingle the teams. As soon as the teams go to the field, they should stay separate from each other to make sure that if, God forbid, one team gets a case, this case is not spread to other teams and you don't have to pull out other teams. Obviously, like team members should follow general precautions for social distancing and mask wearing, etc. They should check their health, their temperature, their feelings twice a day, morning and evening, and report to the team lead, and then team lead must report once a day to the survey manager centrally, and there should be a procedure established, and survey manager should keep a log of that so that every team lead reports to him every evening, and there should be a log, and this should be mandatory. Next slide. So obviously, if you get a case or you have a team member with the symptoms that fit the definition of suspected case, you have to withdraw the team from the field work and replace the team with someone else, with another team that you should keep in reserve, and that person who fits the suspected case definition should be tested as soon as possible. Now, during training, the principles are the same. First, keep the training as short as possible, right? So obviously, the interviewers need to be trained on the questionnaire, and this is unavoidable. And then everyone, including the measurers and interviewers, need to be trained on the general survey objectives, logistics, procedures, and also on the use of this PPE and these IPC procedures that we are discussing. So the trainings should be done with as few people as possible in outdoors or in very large rooms with good ventilation that will allow good social distancing. And before going to the field, after the teams are trained, they need to be tested, and they need to get negative tests before they're allowed to go to the field. Obviously, it's also useful to test the teams before you start the training, but at least, but this is a second priority. If you have only one chance to test the teams, we recommend do this test after the training before they go to the field. We also introduce a notion of experienced measurer. We are saying that if you can find enough experienced measurers who fit our definition, and definition is that they already did at least one standardization test in the last 12 months, and they participated, I believe, in a certain number of surveys over the last 2 years. These measurers can be considered experienced measurers, and you can skip standardization tests. So if you can find very good experienced staff that you used in the previous surveys and they've been recently trained just before the COVID, you can skip doing the whole standardization test now. You just need to show them a short video to refresh their knowledge about the procedures and common mistakes. If you cannot find such stuff, then you will need to do standardization test, but we also give some details about how to make it more secure, less prone to spread infection. Not to keep, not to do 5 children in the morning, 5 in the afternoon, to to do as few teams simultaneously as possible, etc. So all these details you will find in, I think, in clear and concise language in the document, and we encourage you to look at the document. The last part of the document, last slide. Next slide. I think it's all right. Yes. So, and then the last part of the document is the table to help you calculate the quantities of supplies that you need for infection prevention and control. So it will tell you how many masks, how many gloves, how much disinfectant, and how many, let's say, handheld thermometers for screening you will need for your field work. And it not only lists those items, but it also gives formulas, specific formulas, how to calculate the quantity for each supply. I'm going to stop here. I think we are just on time.